A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a surprising turn of events, Susan Monarez, who was appointed as the director of the Centers for Disease Control and Prevention (CDC) just weeks ago, has been ousted from her position. This decision comes less than a month after her confirmation by the Senate, raising eyebrows and questions about the stability of leadership within one of the nation's most critical public health agencies. The Health and Human Services (HHS) department confirmed Monarez's departure, thanking her for her service but providing no clear explanation for the abrupt change. HHS Secretary Robert F. Kennedy Jr. stated that he has full confidence in his team at the CDC, who are tasked with protecting the American public from infectious diseases. However, this confidence seems to be overshadowed by a wave of resignations from other senior CDC officials, indicating a potential crisis within the agency. At least 3 top leaders have resigned, citing the recent leadership changes and a growing sense of disillusionment with the agency's direction. Daniel Jernigan, a prominent figure in the CDC, expressed his departure was due to the current context in the department, while Chief Medical Officer Deborah Oury warned about the rise of misinformation regarding vaccines. Oury emphasized that the science at the CDC must remain untainted by political agendas, a sentiment echoed by Demetra Daskalakis, who criticized the ongoing politicization of public health. The turmoil comes at a time when the CDC is already facing significant challenges, including layoffs and budget cuts that threaten its ability to function effectively. The agency is still reeling from a recent shooting incident outside its Atlanta headquarters, which was reportedly linked to frustrations over COVID-19 vaccines. Monarez's tenure as director was marked by tension with the Trump administration, particularly concerning her stance on vaccines. Her public statements advocating for vaccination as a means of saving lives were reportedly met with dissatisfaction from the administration, which has taken a more skeptical approach to vaccine policy. This conflict culminated in her inability to publish an op-ed regarding the Atlanta shooting, a move that further alienated her from the administration. The political landscape surrounding public health has become increasingly contentious, with President Trump and his allies pushing for more aggressive measures in crime reduction, while simultaneously facing backlash over military aid to Israel and internal party divisions. A recent poll indicated that a significant portion of the American public opposes the administration's plans for increased military support to foreign nations, reflecting a growing divide on foreign policy matters. As the CDC grapples with these internal and external pressures, the future of public health leadership remains uncertain. With Monarez's ouster and the resignations of other key figures, the agency's ability to respond effectively to health crises is in jeopardy. The situation has sparked discussions about the politicization of public health and the need for a more stable and scientifically driven approach to managing health issues in the country. As we move forward, the implications of these developments will be closely monitored, as they may have far-reaching effects on public health policy and the trust of the American people in their health institutions. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.